Nearly a quarter of patients brought to hospital in an ambulance are facing dangerous delays getting into hospital in England, according to NHS data. Ambulances are meant to hand over patients within 15 minutes of arriving, but in the past week, 23% out of nearly 84,000 patients brought in waited over 30 minutes. Well, joining us now is Patricia Marquis, who's Director for England at the Royal College of Nursing. Thank you very much for joining us. These sound like troubling waits. What's the impact on patients when they are kept waiting?
Well, I think it's pretty clear if you're in an ambulance and not, well, number one, you've probably had to wait for that ambulance and waiting actually then to get into an emergency department it's not right. Ambulances were not built to be the units that you're cared for in for a long period of time. So the impact on the patients will be significant. Of course, there will be really well educated professional staff there with them in those ambulances, but it's not the right environment to be being treated. We should have a system that enables us to offload from ambulances into emergency departments quickly. But our system at the moment, our services at the moment are really overloaded and really up to pressure. And it's failing patients right now.
When you say the system is overloaded, do you mean that you've not got enough staff, enough nurses really to sort of, and maybe beds to take people in?
Yeah, I mean, beds, we can buy beds. Beds are not a problem. The workforce is the problem. At the moment, we don't have enough nurses. We don't have enough doctors. We don't have enough of many of the staff groups within the NHS or indeed in social care. So from my perspective, there aren't enough nurses. So it is a really, the system is very, very pressurised, dealing with the impact of COVID that has been visible to all of us. But we went into the pandemic with massive nursing shortages. The pandemic hasn't helped that. And now with the pressure of the pandemic rising again, as well as the services trying to catch up on the backlog of services that it missed over the last 18 months, then the pressure on the system is just huge. And it certainly is now having an impact on patients and the care they're able to receive.
What's the short-term answer, though? Because you don't just conjure fully qualified nurses out of thin air. It takes years to train.
I think it looks bleak for what short-term answers there are. There are long-term answers that prevent us getting in this situation again, that the government must listen to. Having a workforce plan that's fit for purpose is vital for the future. In the here and now, the message has got to be that the government, the NHS, social care have got to look after their staff. Every one of those staff is vital. We need to keep them at work. We need to keep them safe and well at work. So they need, we can't be just cancelling annual leave, for example. Staff need their breaks. They need to be able to finish and start on time. All things that go out of the window when you're under such pressure, but they're all things that are really vital at the minute to keep people fit and well and able to continue to come into work. Clearly, there's things that the public can do too. COVID is starting to have an impact. There are large numbers of staff that are being affected now by COVID and having to isolate or having COVID themselves. So we really need the public to play its part by being careful, socially distancing, washing their hands, wearing masks, all the things we know and are really important to try and protect the NHS and really try and minimise, though it already is up to pressure, but minimise the impact that those things, COVID particularly, will have on the service.
When you describe what it's like working in the NHS as a nurse or a midwife at the moment, how are you going to attract anyone to come and train and join a workplace that's so fraught with pressure, danger at times, and pay rates that don't go up very high?
It's a really good question. What we've seen is that more people have actually been attracted to joining the profession since the pandemic started, and we have to hope that the visibility that has been given to nursing and other healthcare professionals during this period is long lasting and that it does have the impact. It's an amazing profession. It's an amazing job. Right now, our priority has got to be to retain the staff that we've got. Longer term, the pressures, we have to believe the pressures will change, and they will change. Absolutely, they will. But right in the moment, our priority has got to maintain, or retain rather, all of the staff that we've currently got, treat them well, be honest with the public about the pressures that they're under, send them the right messages, government. Think about their pay. Think really carefully about the messages you're sending out about whether these pressures are sustainable or not. They're not. The workforce at the front line is really feeling their pressures, and they need to know that you understand that. So there are things we can do short term. Long term, I would encourage everybody to think about becoming a nurse. It's a brilliant job, it really is, and you can make a difference to people's lives, and that is the most rewarding thing there is. But at the minute, please just look after them.
Patricia Marquis from the Royal College of Nursing, thank you very much.